Rising cases and full hospitals, the government closes schools. Unsustainable situation. Schools suspended in areas with high influenza incidents. Health authorities. Season started early. Risk of hospital overload. The influenza infection curve has started to rise sharply again. Treatments and emergency rooms are recording a steady increase in admissions and hospitalizations, particularly among children and adolescents. Faced with a situation deemed unsustainable by experts, the government has enacted an extraordinary measure. Temporary school closures in the most affected areas, with remote learning implemented where necessary. Why are schools closing? Steep increase in incidents. Reports from health authorities indicate outbreaks that have been active for months, with a marked increase in cases in recent weeks. Hospital overload, pediatric wards, and emergency rooms are under pressure. Hospitalizations due to influenza complications are increasing. Early season. According to virologists, the early start of the wave has derailed the system's preparations. The international context. The phenomenon is not isolated. East Asia, particularly Japan, recorded an early start and epidemic-like numbers as early October. In some prefectures, over 100 schools were closed. Nearly 150 minors, out of 287 total hospitalizations, ended up in the hospital for flu complications. As of October 10th, 6,013 cases attributable to school and community outbreaks have been reported, raising the risk that the virus could spread to countries entering winter in Asia and Europe. What's circulating? Clinicians indicate the likely culprit is an AH3N2 strain, already responsible for a peak between Australia and New Zealand in recent weeks, at the tail end of the Southern Hemisphere winter. This year, the increase in people treated for influenza began 5 weeks earlier than usual, observes Vinod Balasubramaniam, Monash University, Malaysia. Japan has had early onsets in the past, but never this early, adds Ian Barr, Deputy Director of the WHO Collaborating Center for Influenza in Melbourne. Among the factors, increased international mobility and climate instability. Aggravating factors, anomalous weather. Sudden warm-cold alternations in major cities, conditions that favor transmissibility indoors. Suboptimal vaccination coverage. The influenza campaign is underway, but the early start of the season has caught many families before the vaccination. School overcrowding, large classes, and poorly ventilated environments amplify the spread. Measures decided temporary suspension of in-person classes in areas with incidence rates above the threshold. Distance learning activated where necessary. Strengthening pediatric hospital facilities and continuity of care. Acceleration of the vaccination campaign. Priority given to vulnerable groups, those over 60, and healthcare and school workers. Recommendation of wearing masks and ventilation in crowded environments, hand washing, and isolation in case of symptoms. What happens now? The measure will remain in effect for the time strictly necessary to bring hospital pressure back under control. Health authorities will monitor positivity rates, hospitalizations, and the progress of school outbreaks on a daily basis. Any staggered reopenings will be evaluated based on local indicators.